Hello and welcome back, and thank you for selecting Mission CIT's EMS Care courseware. I'm Missa, your host for the first part of this chapter about head and spine injuries. My colleague Justin and I will take turns presenting the material. As a reminder, or in case you are starting in this chapter, most of the course materials are available via audio, so you can listen while on the move. The audio is intended to complement the written materials and may vary from the words in the slide deck. More importantly, we will include some essential additional information, so be sure to listen carefully. Justin, do you have anything to add?
Thank you, Missa. First, I want to thank the course instructor Amy Lynn Roberts for providing the guidance and material to share with you. If you should have questions, please notice the left-hand column on this page, and use the tab named Browse Q&A. Here you are able to view other students' questions and responses, or ask your own. Answers will be made available within one business day, or sooner. Questions will be covered during the chat and video sessions as well. Missa, please continue.
Thank you, Justin. So, there are 3 videos during this topic. The first video, called The Nervous System, will be shown after the lesson on the anatomy and physiology of the head, neck, and spine. The second video, A Spinal Injuries Animation, will be presented after Lesson 3, Injuries to the Spine. And the third video, Spinal Immobilization of the Seated Patient, will be available after Lesson 5, Patient Preparation and Transport. We begin our lessons with the anatomy and physiology of the head, neck and spine, and then continue with the various aspects of related trauma. We then discuss likely methods of injury, assessment, and care of these patients. And due to their special nature, we examine how to prepare and transport these patients. As you go through your studies, there are 5 core concepts to take into consideration. 1. Understanding the anatomy of the nervous system, head, and spine. 2. Identifying skull and brain injuries and their emergency care. 3. Knowledge of trauma to the neck and related EMS care. 4. Recognizing and assessing spinal injuries and their pre-hospital care. And 5. Awareness of spinal motion restriction issues and methods to immobilize various kinds of patients with potential spine injuries. After the lesson on patient transport, there will be a topic review before the quiz at the end. You will need to answer 75% of the questions accurately to get credit for this topic. Good studying.